Okay.
Good afternoon, and thank you for joining us for the 5th webinar in our COVID-19 webinar series for the College of Health and Human Services. Today we'll be talking about a very timely topic, learning pods, insights from a public health and an education technology perspective. Our moderator today is going to be Dr. Bob Weiler, Associate Dean for Academic Affairs at the College of Health and Human Services. With that, I'll turn it over to Bob.
Thank you, Michelle. Appreciate it. And again, welcome to George Mason University and the College of Health and Human Services. And on behalf of Dr. Jermaine Lewis, Dean of the College of Health and Human Services, I'm glad that you were able to spend some time with us this afternoon for this webinar. For those who are guests to George Mason University, welcome. Just something a little bit about Mason is that we are the fastest growing R1, that means Research 1 intensive university in the country. As you may or may not know, we are located just right outside of DC. We have around 26,000 undergraduate students, a little over than 7,000 graduate students, and master's degree students, and we have about 2,100 doctoral students in our program. As an institution, we are recognized for being innovative, very diverse and inclusive, our entrepreneurial spirit, and our accessibility to students from a wide range of backgrounds. In terms of our panelists this afternoon, well, let me first talk about the structure for the day. I'm going to provide a brief introduction to our panelists, and then we will have our actual discussion, and then we will have a Q&A session. Please submit your questions via the chat room, the chat box, and Michelle is going to help facilitate the discussion and getting your questions to the panelists so we can respond in a timely manner. With that said, let me introduce our panelists for this afternoon. First is Dr. Jared Bora. He is an associate professor in the Division of Learning and Technologies at George Mason University, College of Health, Education, and Human Development. He is the professor in charge of the blended and online learning in the schools master's and certificate programs that are devoted to improving teacher practices in online and blended learning environments. Before earning his PhD at Brigham Young University, Jared taught history at a junior high school for 6 years. He has also taught online and blended courses since 2008. He currently advises schools and school districts on their online and hybrid learning strategies. Dr. Amira Rossi is a professor of global health and epidemiology at George Mason University's College of Health and Human Services. She is an epidemiologist with expertise in infectious diseases, epidemiology, and in evaluating interventions to reduce the transmission and impact of infectious diseases. She holds a PhD in global disease epidemiology and control from the Johns Hopkins University. Dr. Rojas previously served as the science director for the Pew Commission on Industrial Food Animal Production at Johns Hopkins and was an epidemic intelligence service officer at the Centers for Disease Control and Prevention. She currently advises judicial systems, school districts, and businesses on how to safely reopen. And so with that, I would like to turn the panel discussion over to Amira to get us started with today's panel discussion.
Okay, thank you, Bob, and thank you, Michelle. Hi, everyone. So I would like to start off by making sure that we acknowledge a few things about COVID-19. First, there's a lot that we don't know, especially around transmission dynamics and the role of children in spreading the virus. We're also in the midst of an ongoing pandemic, and at times this is very much an emergency. And so we are facing really unprecedented issues regarding infectious diseases and regarding this pandemic. There are a few other things that I think we have to highlight in terms of what we do know so far about this virus. So in the last month or so, a few studies have come out that have emphasized that children do have some lower risk of having really severe consequences of the virus. However, recent studies are also pointing to the fact that some children and young adults have high viral loads or are carrying a lot of virus when they're not symptomatic at all. And those findings have really helped us reshape how we're thinking about transmission. And so some of you may have seen some reports in the news about whether or not children and young adults may be considered silent spreaders of the virus because they're asymptomatic or pre-symptomatic. They don't have virus, and yet they don't have infection, I should say. They don't have symptoms, but they seem to be carrying a lot of virus. And so what we want to keep in mind is that these are interesting new findings, and there's still a lot that we don't know. And how do we then proceed with maybe some in-person activities with that kind of thing in mind? The other big thing to keep in mind is that this virus has also highlighted the ongoing inequities that we see in terms of health and education, especially among minority populations in the US. And so that's another thing that we need to consider when we're thinking through how do we go back to the school year. Most of it will be or is virtual with some in-person activities in some jurisdictions in the country. How do we go about doing that while minimizing the inequity that has persisted in this country in health and in education? So those are the two really important things I think we have to keep in the front of our minds as we think through education in this COVID era. And with that, I'll turn it over to Gary.
Hi, thank you, Maria. Really happy to be here with you. I don't know if you can see on my little video, but I have some artwork back there. That wasn't me, that was my kids. And so I'm also a parent during this time and kind of wrestling with some of these questions. I assume many of you in attendance are parents as well, trying to figure out what to do. It's a challenging time with education, and I've been working a lot with teachers right now, and I don't know if you can hear my kids in the background too. It's a challenging time. Life bumps up against our work lives, and for teachers, it can be challenging because they're now being asked to teach in a very different way. It's almost like someone who is really skilled at playing the guitar they played for years and years and years and years, and then someone gives them a cello and says, okay, play this in front of an audience. You know, it's a challenge, and it can be a bit bumpy, but I've been amazed at how skilled and adaptable teachers have been with this time. Working with many of them, they really want to succeed and be successful, and so I've really been amazed at how quickly they've adapted and have really helped their students adapt as well. So when we talk about learning pods, there's a couple things to consider. One is size. So typically the size is under about 8. That's even quite large. When you're talking about an educational perspective, when we group students in a classroom, for instance, groups of about 2 to 4 are really common. And so there's some advantages to that because every student, when you're working together and collaborating, every student has an opportunity to contribute and to have their voice heard. So that's something that you might want to consider when you're forming pods as well. It's maybe 2 to 4 is the right size for you. The other thing you want to consider is the source of instruction. So in some pods, they're keeping their students enrolled in the public school or private school, whichever is the case. And they're receiving the instruction through that, but then they're pulling the ability to kind of monitor and encourage student progress. We know that learning online is a challenge, and so they need support on how to facilitate the monitoring and encouraging and things like that. And so sometimes parents will develop these pods so that they can take turns with those responsibilities, like a certain part of the day in each home or something like that. Some pods are hiring tutors to supplement the instruction provided by the school. Commonly, these tutors are in math or some of the other subject areas where maybe parents aren't as familiar with or are really high stakes. There's also some pods are actually removing their students from the public school and doing essentially a co-op, a homeschooling co-op that have been around for a very long time. And in some cases, these really affluent groups are actually pulling their funds and hiring a private teacher. There are many Facebook groups and on social media, lots of groups. For instance, there's one that I recently joined called Pandemic Pods, Fairfax County, Virginia. And that's a private group that you can join with over 1,000 members, I think about 1,200 last time I checked. There's also other communities that are being formed to kind of facilitate the formation of these pods. Like I said, they're not entirely new, but because of the pandemic, they're becoming much more common. Turn it over to you, Bob.
Okay. Okay. Thank you, Jared. In terms of trying to get this started, I'd like to have some starter kind of kick things off. How can we keep children and caregivers safe when doing a pod? You know, what should families ask of one another and caregivers to reduce the risk of infection and increase the likelihood of successful learning?
Yeah, so I'll start off by talking specifically about COVID-19 transmission dynamics and what we know so far to disrupt transmission. And I'm going to go back to what we have been doing since April or March. Children and their teachers and the staff will have to practice social distancing, meaning stay at least 6 feet apart, and will also have to wear masks, especially when they're getting very close to each other. Now, if you're doing a pod where everybody is able to agree to abide by social distancing guidelines while they're outside and will wear masks whenever they're outside, then you could consider your pod as sort of your family unit. But in order to do that, you need to agree that everybody in the pod, all the children and all of their family members, will minimize their exposure to people outside of the pod. They will wear masks if they're out in public. They will stay 6 feet apart from everybody who's outside of their pod. And if they have a lapse in exposure, they will let everybody in the pod know, and that family, that child, will quarantine for 2 weeks. If you can do that, then you can safely pod. Everybody really has to agree to do this. Otherwise, you're going to face a situation where the pods could be infected and everyone in that pod could be at risk for infection. So if you really can't make that social contract, make those promises, then even in your pods, you're going to want to consider the mask and the social distancing. We found that the smaller the pod, the more effective the agreement to do the social contract. So, if you're in a pod with 2 or 3 other families, you're able to find families that can agree, to do this. But as soon as you go into 5 families, more than 5 families, it gets harder and harder because a lot of us are, getting sort of fatigued at having to wear the mask every time we're outside and maintain social distance every time we're outside and things like that. But those are all important things to think about, how large or how small your pod is, and if everyone in that pod can truly agree to a social contract, and if they have a breach, that they let everyone know. So those are going to be really critical things to keep in mind.
Okay. Jared, any follow-up on that?
Yeah, I know on the agenda we had that we'd be talking about advantages and disadvantages. Do you want me to cover some of those, or is that later?
Well, I guess if you think it's, you know, for the flow, if you want to just respond briefly about some advantages and disadvantages, and then we come back to them and pick up others later.
Oh, are we covering those later? I wasn't sure.
Yes.
So okay. I don't really have anything to add about the safety. Just kind of adding to what Amira said is that size is really important, and from a pedagogical standpoint, small is okay. It doesn't need to have large numbers of students in order to have the same or similar benefits.
So, Jared, let me ask you, I have 2 young kids, and we have a social pod, 2 families, you know, we socialize, and the question that, you know, keeps coming up in our little circle is, you know, how bad is it for kids to not have lots of kids there in their age group to hang out with? You know, is this really detrimental if we're in pods of 2 or 3 families? What does that do for education and for development?
We know that learning is social, and play is a really big part of that development. And so obviously you can have social environments on a screen, but you're clearly missing a lot of that social and play opportunities. And in school, one thing that we really emphasize is that not only do we need to teach the curriculum, but we need to help them to develop certain skills. We typically call them the 4 C's, which is, you know, critical thinking, creativity, communication, collaboration skills. Those are often developed in semi-structured or unstructured environments. And so the school can provide lots of opportunities to develop those 4 C's and those types of skills, but also as parents, we want to focus on those and really provide some unstructured play time for kids as well.
Okay.
And, you know, is there any sort of number that we should strive for, where it's like the ideal number for a kid to thrive? Is there around this many kids, you know, plus or minus 2 years from their age?
Yeah, that's a good question. I don't know the answer to that. I do know when you were trying to group students in the classroom, again, we try to do about 2 to 5 students, but even having 1 or 2 in a group can be really beneficial, especially if they tend to gel well. And I know with these learning pods, we tend to go to our social circles to find them, and so we can kind of know where they can really play well with certain kids, or they seem to work well together, and kind of build on those existing relationships.
Another question that, you know, a lot of us were thinking about for a long time, you know, we talked about how schools, especially elementary schools and middle schools, right, as you get older, the classes get more crowded, and a lot of times that's not the ideal learning environment for kids. And so there are some charter schools or, you know, private schools that have smaller class sizes. And, you know, I've heard all kinds of numbers about the ideal ratio of like caregiver or teacher to children, right? Like 8 kids to a teacher or something like that.
Right.
Right. So what is the range? And, you know, part of me thinks that, you know, if the range is actually less than 8, like 5 to 8, let's say that's the ideal teacher, child to teacher ratio, then, you know, we're not going to be harming our kids too much if we have the pods, and if it's only for another year or so where we're podding, it may be fine, and we just have to learn from you the best practices to do this.
Yeah, I think oftentimes it's the class size that makes one of the biggest differences in our students' learning. And I think that's one reason why people enroll their students in like private schools if they have the means. It's the class size primarily that they get that attention. But even in public schools, they do a lot, especially with the younger grades, to bring in paraprofessionals or volunteers to kind of support with that. I did get a note from Michelle that maybe now would be a good time to talk about some general advantages and disadvantages, if that's okay. I think that when you transition from an in-person environment to an online environment, learning environment, it takes new skills to learn in that environment. So not only do students need to learn the material, they need to learn how to learn online, which can be challenging. And not only that, parents need to learn, how do I support students? I might be supporting students really well in an in-person environment, but then in an online environment, how do I do that? So that can be challenging, and we know that especially younger learners, they don't have the self-regulation abilities or the cognitive skills, and so they really need support as far as like monitoring their learning, helping them to structure their learning, knowing how to navigate the systems, keeping track of due dates, staying focused for periods of time. And so parents or adults can be really, really important for student success in those types of environments. We also know that some parents can't provide that level of support that's needed. And so by pooling or creating these pods, it can be really helpful and beneficial because you can share some of that workload. When you do that, though, obviously you're increasing risk that you need to manage, or that Amira is addressing. And in the worst case scenario, you can actually, if lots of this is going on and it's not being safe or done well, you can actually prolong the time schools are closed. Some disadvantages of this is that there's some major equity issues. We already know that in schools there are equity issues. And so this is only going to emphasize or even widen those performance gaps that we're already seeing. And so we do need to be aware of that. Typically, those families that are participating in pods are in kind of middle class or upper class groups. And so you do want to be aware of that. Our schools are very diverse in this community. It's one of the great benefits of living in Northern Virginia. But our social circles tend not to be very integrated. And so when you're pulling from your social circles to form these pods, you're very likely going to form pods that are not diverse. And so when you do that, students are going to miss out on the diversity of thought, experiences, and background, the really rich learning experience that comes from a more diverse setting. Along with that, a lot of parents, I mentioned some parents are now homeschooling and things like that, kind of using those co-op models. And they're turning to resources like Teacher Pay Teacher or some of the other resources that they're finding online that are for free or for purchase. And we're finding that they are quite biased and at times even racist. So an example of something that we see commonly in curriculum is that they use the term slaves instead of enslaved people. So even small things like that can make a big difference in how students are perceiving their learning. We also don't tend to be very diverse in the authors that we're including or the stories that we're telling or the people that we're holding up. So we have to be actually pretty proactive in that. I know that FCPS has created a website. Fairfax County Public Schools has created a website I'm going to put in the chat. A couple of them that have some really great resources. Also, a colleague of mine, Dr. Kevin Clark, has been working with Netflix that really created a great resource called Bookmarks. So they have a website, netflixbookmarks.com, and this is Black celebrities reading Black authors for children. And these are mini videos, probably about 5 to 6 minutes. But just as it's not enough to be say we're not racist, we need to move past that and become anti-racist. I think in our curriculum, we need to move past unbiased curriculum to actually have curriculum that we're actively ensuring that our students don't develop biases. And then I will say that parents tend to underestimate how difficult it is to homeschool. I am a previous ninth grade teacher, and I remember having one parent, there was a triggering event, and she kind of pulled her kid out of school, and then 2 weeks later, that kid was back in school. So I think we can all relate with that. Sometimes we underestimate how difficult this is. In order to teach and provide instruction, it's incredibly complex. Teachers are skilled and certified for a reason. And so when you take that on as a parent, you need to be aware that this is going to take a lot of time and effort. And you can see why some parents with means are turning to, tutors or instructors and things like that. So yeah, I think those are, and I'll just say this, the other thing that you need to consider is school funding. Public school funding is tied to enrollment. So if you pull your kid out of school and do a homeschooling option, you're actually removing some funding from your child's school, especially if that child is going back to that school. That can have some lasting impact. So that's something that we probably aren't considering necessarily, but it is something that you should be aware of if you make that decision. So anyways, thank you. I did have that list I wanted to go through, so thanks for giving me a few moments.
Thanks, Jared. Another question that we have posted here is, how can parents and caregivers best foster learning during this time and in a learning pod environment?
Yeah, I can talk about that too. I think that now is a really fantastic opportunity to help your child find and pursue their passions. I think that it's a great time if you're doing these pods to maybe adapt what the instruction is to your child and allow them to kind of personalize what they're doing. I think that if you're doing a pod, one big advantage of that pod is communication and collaboration opportunities. So finding a rhythm during the day when those can be built in and you can really foster those.
Okay, thank you. And then our kind of last kind of target discussion question is, what expectations, really what realistic expectations should we set for this period of online and hybrid learning?
I guess I can address that as well quickly. Schools are recognizing that this is a difficult time, and so they're focusing on, sometimes they call it power standards or kind of these critical learning standards. And so they've actually scaled back on the amount of material that they're going to cover. And I think that being realistic in your expectations as far as what you can cover in your learning pod as well is really important, and focusing really on those critical things. The other thing, though, is if you are taking over the instruction of your child and you plan on them returning to the brick and mortar school, you want to find out what pacing guide the schools are using, so that when they do go back, then they're ready. Some parents are actually going to schools and saying, hey, we're forming this pod, can we have a special teacher assignment? So, we're staying in school, we're enrolled in school, but it would be really helpful if they all had the same teacher. And school districts have come out, including Fairfax County Public Schools, and have said, no, don't make those requests. That we cannot accommodate, we cannot support these learning pods. And they have some really good reasons why that's a challenge, and equity is one of those challenges. As you can imagine, if lots of parents are making these requests, and then when it's time to go back to school, then you're going to have classes that are not really balanced, And so that's something that school districts have come out and said, don't ask for those special accommodations, and I would agree with that.
I would encourage everybody to submit their questions to the host in the chat function. We'll have plenty of time for questions now. We do have a few questions that have come in related to the virus itself, Amira, and I think it might be helpful for you to catch everybody up on where we are with knowledge about the virus, how long it lives on surfaces, how it spreads, the best way to reduce the likelihood of spread through these pods. It seems like knowledge has come a long way since the early days of March.
Okay, right. So I tell people often to think about how smoke travels. And you can imagine that if somebody has a high viral load or they're carrying a lot of virus, they could spread the virus the way that smoke spreads out. And so a mask is a really great way to keep that smoke right here and keep it from going out to those around you. So wearing a mask is really important when you're out and about. Now, for learning pods, I think we want to consider, keeping the pods small and making sure that everybody that's in that learning pod, the parents, the siblings, that they really follow the social distancing and the mask wearing guidelines, and that they can consider that everyone in the pod behave like a family so that when they're around each other, they don't have to wear the masks and they don't have to social distance. Now, if people in your pod truly feel like they can't wear the mask every time they're out and they can't really follow these mitigation strategies, the social distancing guidelines, then in your pod, you're going to want to maintain social distance, maybe do more activities outdoors, and wear the masks because you don't want that smoke to spread around you, right? Because you might be picking up the virus when you're outside with strangers in a grocery store. Maybe you're not wearing a mask, you're getting too close to people. So if you're not able to stick to the mitigation strategies when you're outside, then certainly when you're inside your pod, you need to wear the mask and practice the social distancing. And I think that's for safety within the pod, that's the number one thing. Make sure everybody agrees on that, because the number one source of the virus is infected individuals. And infected individuals may or may not have symptoms. So you may or may not realize that they're shedding virus and that they're exhaling virus particles around you that could then make you infected and infectious. So those are the important things to consider. Now, fomites or surfaces, right, virus that may be on surfaces, it generally doesn't live long enough to pose a high risk to individuals, individuals who are going about their day-to-day lives, right? So we do recommend that, you wipe down your groceries or keep your mail aside for a day or so that if there is any virus, it can die off. But in general, that seems to be a really low risk exposure. Wash your hands, right, when you come in from outdoors or when you handle things that aren't cleaner in your house. Just wash your hands to make sure that if there is any virus that you've taken care of that. Get the kids in the pod in the habit of that when they're going into their pod, right? Everyone who's coming inside, wash your hands, get them in the habit, remind them, sneeze in the back of your elbow, use tissues and throw them out immediately, right? Those kinds of things are important to keep reminding everybody in the pod to do. The big thing that we've learned in the last month is that in one study of about 200 individuals found that children and young adults who are asymptomatic, who don't have any symptoms, they are actually carrying more virus than adults, older adults who are very sick and are even hospitalized. And so that's where the conversation in the media started to revolve around this issue of could kids and young adults be silent spreaders of the virus, because they look fine, they don't have symptoms, and it turns out they have a high viral load. So we're still trying to learn more, and it's prudent to be careful and to make sure that we're all understanding, that there's still a lot that we don't know, but this is a very transmissible virus, and we need to do what we can to minimize the risk of exposure in our pods and in our families. I've also mentioned that we're going into flu season, so we're going to be indoors more and more. And as we all saw in March and April, it's really challenging to keep your kids indoors and keep them entertained with minimal outdoor activities, especially when it's cold or rainy or snowing, right? So, those are all reasons to make sure that you are very serious in your pod about maintaining the social distancing guidelines and wearing the masks when you're outside of your pod. Because as the weather gets colder, more and more kids are going to have to be indoors. So it would be nice to feel that they're safe in their pod and they can socialize with their friends or their classmates in their pods. And I'm happy to elaborate on any of those as people have questions.
We did have a question about reinfection rates, Amira.
Yes, and this is another one of these areas where we're learning a lot about the virus, and we don't have a definitive answer. There have been a few reports of reinfection. There's one report about reinfection with a slightly different strain of the COVID-19 virus. There's increasing evidence that if you were infected, that you could have an antibody response, probably immunity, for about 4 months, right? There's still a lot that we don't know, and so just because you were infected previously, it doesn't mean that you're out of the woods and you can go about, socializing and going out there without having a risk of getting infected again. So right now, the evidence is really pointing out to reinfection is possible, or at least antibodies tend to wane, and so immunity may last 4 months, maybe more, and time will tell us as we learn more about the virus.
We had some questions. We have a number of teachers on the call today, and there are some questions around metrics that we can be looking at, should be looking at, to show when it might be a good time, a safe time to resume face-to-face learning.
So one thing to consider is the testing statistics and how testing is happening. And this is a bit challenging because we have tended to really test those individuals who are symptomatic, who have symptoms. And so the reason that's problematic is we still don't know enough about asymptomatic individuals, especially children and young adults who seem to have a lower rate of symptoms from infection. You want to keep an eye on the local context, the local epidemic. So, what are the infection rates in your county? What are the infection rates in your county by age group? And another big question is, who's being tested? So if we're still primarily testing symptomatic individuals, that's not really going to help us understand this whole issue of asymptomatic spread of the virus. Some places are testing students and staff before they're letting them resume in-person activities. And that's very helpful and it's useful so that we know who's going to come into, we want to try to guarantee that whoever comes into the school isn't infected. But the problem is you can get infected a week later, 2 weeks later, and unless you're monitoring the students, children and young adults, it's going to be difficult to detect outbreaks early on because you're going to end up defaulting to identifying cases once they develop symptoms. So those are all things to really consider carefully. And that's why the recommendation is, since we're not able to do routine surveillance testing in schools, we're asking everybody who's going to be in class, to wear masks and to maintain that social distance and do as many outdoor activities as possible.
Thanks for that, Amira. We do have some questions for resources for best practices around micro-schooling or homeschooling. And what I would say in advance of Jared responding is we will share not only this recording, but we'll also share any of the resources that have been posted into the chat. We will share those in a follow-up email so that everybody has a list of those resources. And I believe that Jared has a longer list of resources on the college's website that we can share as well.
Yeah, when you're working with students, one thing that you need to think about is how are they engaged? And when we talk about engagement, we're talking about hands-on, minds-on, and open hearts, right? So really focusing on their hand, head, and hearts. And I think that in a learning pod, what parents can really do, even if you don't know the content area, if your student is still enrolled at the local school, really focus in on encouraging your students, being careful of how you portray your attitudes about what's going on, and being fairly positive around your student. It's also really helpful to focus in on encouragement, but also on monitoring them, making sure that they are where they need to be, that they're making adequate progress. Students have a hard time, especially young students, of contacting a teacher when they need help. And so a parent can be a big advocate for the student, and if the needs aren't being met, to turn to the teacher and see what can be done, or taking advantage of like lunch bunch times or kind of online office hours in the upper grades. As far as teaching goes, a best practice, if you're deciding to go down the homeschooling route, a common practice that teachers will do is they start with the learning objective or the standard, and then you have to work your way backwards. So you find the standard, and then you just decide, how am I going to know when the student has met this objective? So that might be a quiz, but it can also be a project. It can be an authentic project. And then from there, you work backwards. So, okay, so what are the materials that students are going to need? What are the resources that they're going to need? The activities that they'll have to engage in order to be successful in that assessment. As far as the day-to-day structuring of the day, I think that it's good to have mind breaks kind of built in, and to get them active and out of their seats. Sometimes it can be, let's go on a nature walk, or let's try to get outdoors, work in PE strategically during the day. We know that that's really an important time for students to learn, but also to prepare to learn. Their attention span, depending upon the age, is, younger kids, they have attention span of about 6 to 10 minutes. And so you really need to switch up the activities constantly. Ask them to do something for 10 minutes, and then have another activity for 10 minutes, and kind of work that through. And when you're designing the activities can be categorized as either passive, they're kind of watching a video, or they might be reading something or something like that, or it's active or interactive, where they're actually interacting with you, answering questions and things like that, or with their peers. And also creative activities. So actually having them create something new. That can be as simple as drawing a picture, or it could be creating a larger project. But I think when you're working on those kind of 10-minute blocks, to think about, okay, is this time going to be passive, interactive, or creative? And if you have a lot of passive time, then you really need some interactive time and definitely some creative time.
That's really helpful to know that their attention spans are shorter than many of us might have thought. This is a question for both Amira and for Jared. The first is about how long we think this pandemic will go on, which of course will influence how long we are learning virtually for. And then the other piece of that question is how to prepare our students for returning to what their prior learning situation was, whether that was, moving from homeschooling to back to public school or moving from virtual learning back to face-to-face learning, all within the public school environment. So Amira, let's start with you on, obviously you don't have a crystal ball here, but what is your sense on timing and some of the factors that will influence this?
Yes, so, looking back, right, I think the leaders were really hoping that we can have regular activities or close to regular in-person activities as possible, by the middle of the summer. And the public health, infectious disease folks, I think a lot of us have been saying that unless we have a vaccine or some sort of treatment protocol in place, some sort of effective treatment protocol in place, it's going to be really difficult to resume or get close to resuming in-person activities. And so how long we're going to be sort of in this, prolonged phase 3, phase 4, what have you, is really going to depend on those two things, when we get an effective vaccine and or when we get effective treatment protocols. So, all indications right now are that we're going to have increases in cases as we move indoors and as we progress through the flu season and through colder months, which means that, realistically, we might be looking at February or March, if we're waiting for the numbers to drop again, maybe we'll have a vaccine sometime during that time period if we're very, very, very lucky. And it's unlikely we've never had a vaccine developed and then out in the public as fast as, certainly political leaders are trying to push for. So, I think that we just have to prepare ourselves for having to do mainly virtual school activities for the remainder of this year and possibly into early next year. And then in the meantime, we need to wear masks and practice social distancing. And I think if we're able to do both of those things and stick to them, and frankly, we really haven't been, but if we were able to do that, if we are able to do that, we will see a resumption to normal activity sooner than that rough time frame I gave you. And so, it's going to, right now, it gets back to having high compliance with wearing masks and practicing social distance. And if we can't all do it, or if we, for some reasons don't want to do it, it's just going to prolong this, this occurrence of outbreaks. Thanks
for that. We have about 5 minutes left, and we do have questions about social emotional and how to help our children through, and honestly, parents who are also dealing with social emotional pressures. I think this is for both of you, how to help our kids through anxiety around shifting models, and what resources or what tips do you have for them?
Yeah, that's a really, really great question. But before I answer that, I did want to go back to the attention span comment. That the attention span can go longer the older they get. So I was kind of talking about the littles. but the older they get, you can have longer blocks of activities. As far as the socio-emotional status, that kind of goes into the heart part of it. You know, when I mentioned that there's a hand, the head, and the heart. I think that you really need to recognize what their needs are and respond to that, and then also kind of give them some strategies on how to work through those frustrations. And one term that we hear a lot about is grit. Sometimes we use that with teachers, but also with students, to help them kind of develop that grit where they can do difficult things. And one way to increase their confidence is to recognize when they have that grit and celebrate that. And the other thing to celebrate is not to celebrate their intelligence, or, you know, maybe they got a good grade or something, but to compliment them on their effort, and to really focus on themselves and not to make comparisons across students and across others, especially in a learning pod where it's small. You can see where some students are going to be making a lot of comparisons, and really encouraging them to focus on what they can control, and to kind of celebrate their growth, and then attribute that growth to their effort, things that they have an internal locus control for, or a sense of control over.
Yeah, and I mean, for both, you know, children, caregivers, teachers, it's very clear that the mental health impacts of this pandemic are very severe. You know, isolation, not being able to go out, you know, feeling this constant low-lying or low level of stress related to the pandemic, that's really had significant consequences on mental health markers. And so I think, you know, these are all things that we have to acknowledge. And, you know, children are likely feeling the same kinds of stress. There's a few reports about, you know, how children demonstrate anxiety, especially related to COVID, except hand washing and, you know, fear of going out and things like that. And I do think that we need more instruction on how to deal with those very specific mental health issues that are tied to the pandemic, that fear of going back into public. And it's not for, you know, not all kids feel that way, but there is a proportion that do. And I wonder sometimes, you know, as we reopen, what kinds of resources should we be looking for? What will we need to support everybody to go back to some in-person activities when the time is right?
Thank you for that. I see no additional questions in the chat. Are there any closing comments either of you would like to make about successfully navigating this process, or about COVID and learning in general?
You know, from the infection control side, I think if we all, you know, really work hard on sticking to those public health mitigation strategies, wearing the masks around in public, maintaining that social distance, that we, you know, if we all do it, right, we're going to go a long way towards getting closer to having more in-person activities. And I think we just all have to support each other and remind each other about, you know, why we need to wear the masks and maintain the social distance in order to get through this, so that we can pod safely and see each other safely. Yeah.
I'll just reiterate that, you know, I'm from Utah, and Utah right now, they're having protests about the mask, wearing the mask. And in my mind, it's such a simple thing. And one kind of viral video there with the students kind of talking with the parents saying, please wear the masks. We don't want to have our schools closed, you know, and I think that is so important. Wear the mask. It is not difficult. And if we all do that, then I think that schools will open sooner, you know. And so I've loved hearing from Amira and her guidance, and Really appreciate the opportunity for this, and thank you for everyone who came.
And thank you, Jared. I learned a lot, and I'll be applying it to both of my kids.
Yeah.
I think everyone on this call is in that same boat, and I appreciate all the great questions that have come in. We always welcome suggestions for future webinar topics. We try to stay very timely with what's going on in the news and in our lives. So please feel free to submit those either via the chat or to me directly. And thank you very much to Dr. Weiler for moderating us today, and to Dr. Ruth and to Dr. Borup for all your fabulous input. This was very insightful.
Thank you, Michelle, and thank you, Bob.
Thank you.
Bob.
Thank you all.
Take care.
Thanks, everyone.